Good afternoon and welcome to the Becker Spine, Orthopedic and Pain Management Driven ASC and the Future of Spine virtual event. We're so excited to have you join us for our closing keynote interview, Innovation, Creativity and Excellence. I'm Alan Condon with Becker's Hospital Review and I'll be your moderator for today's session. Before I introduce today's presenter, I'd like to go over a few housekeeping items. We'll have time at the end of today's presentation for a short question and answer session. You can submit any questions you have throughout the presentation by typing them into the Q&A box you see on your screen. If we do not have time to get to your question, we'll follow up with you directly after the event. We look forward to hearing your questions. You'll also find a few engagement tools on your dashboard. Be sure to check out our resources section and fill out our event survey. This session is being recorded and will be available on demand following today's event. We'll send you instructions on how to access the on-demand recording once today's event concludes. At this time, it is now my pleasure to start today's session by introducing our presenter. That is Dr. James Lynch, spinal neurosurgeon and founder and chairman of Spine Nevada. Dr. Lynch has 25 years of experience as a spinal neurosurgeon, performing more than 500 spine surgeries annually in hospitals and ASCs. After earning his medical degree from Trinity College in Dublin, Ireland, he completed a neurosurgery residency at Mayo Clinic and 3 fellowships in spine surgery. In 2004, Dr. Lynch founded Spine Nevada, where he operates as chairman and CEO. He also serves as a partner and director of spine services at Region Surgical Health, as well as chairman and director of spine programs at Surgery Center of Reno. Jim, thank you so much for taking the time to be with us today.
It's a pleasure to be here at Becker's Novel Forum, and I'm excited to have a nice discussion.
Well, we really appreciate your time, and to kick things off and get the ball rolling, I'd love to firstly just get your insight and ask you what innovations you see most. What innovations are you most excited about in spine in the next 5 years?
There's a whole spectrum of innovation that's occurring here, which really helps us with patient, outcomes and better care for the long run. So I think if we look at it, navigation is clearly one of the most important aspects of that. It's really developed well over the years and really come to fruition as a baseline platform. It's really, navigation is akin to what MRI did for imaging back in the 80s. So the advancements in navigation, whether it's the standard platform, Medtronic, O-arm, BrainLab, system has kind of allowed us to get to the next level then in robotics, and that's Mazor, BrainLab, Circ, and then indeed the Globus Excelsius robot. The next event now, the next level of iteration that I'm excited about is truly augmented reality, and that's Augmentix. It's called X-Vision, and this really is X-ray vision. It's virtual spine care. You're looking with a heads-up display, looking at a 3D image of your spine and the CT scan being placed on your retina, and you can do really true image guidance in the standard fashion, but it's really a direct hands-on. You're not looking at a screen, and it has all the advantages of a neuro navigation platform, yet it's perfect. It's a lot more cost-effective. It's better for hospitals in this current climate. It's perfect for surgical centers and looking at ASCs in future and doing minimally invasive spine care. I'm really excited about that. We're just starting it here in our practice and in Reno, and looking forward to it. I think the next thing is that we get away from navigation. If we look at, no question about it, surface technology, implant design and technology is huge. We've seen that nanotechnology, and whether it's with a Titan surface and a lot of movement away from peak plastic products, which are basically inert plastic rings with an expensive biologic inside in it. Now we've moved to using the titanium cages themselves. 3D printing has really helped that and made it a more cost-effective and novel design technology, and that's taken companies like 4Web, and there have been a lot of iterations and copies of it. 4Web looking at mechanobiology in a kind of a snowshoe effect where you distribute the load across the surface of the implant to the bone, and that leads to higher fusion rates, less subsidence, and really it's another advancement in that field. As we're looking going forward, interlaminar technology is huge. We had iterations where we had clamps placed in the back of various descriptions, and then we had Coflex, which allowed some motion. And the newer iterations now, there's a Vertiflex implant, but the one I'm actually really excited about, which has revolutionized my practice, is a Minuteman Spinal Simplicity implant. And while it can be used standalone, I use it to back up 360s, so anterior constructs with the X-lips, and I call it the U360. It's a unique 360 or uni-incisional 360. So that's a game changer for us. You know, we're getting, for the spine surgeons in the hospital, it's a DRG 454, which is a front-back code, but instead of single position dual incision surgery, putting screws in the back, we just do everything through one small incision in the side, and that's one level or two level. And you know, that can be an outpatient. I've done it as an outpatient, but it's game changing. You're placing the X-lip and through the incision from the front, and then the percutaneous interspinous clamp with Minuteman Spinal Simplicity through the same incision through the back. And you know, the patient can go home the same day, or certainly in the hospital within 24 hours. That's been huge. If we look at that, well, I'm excited about that. And they're really the huge advancements as we see going forward. There are many others.
Fantastic. So a couple of stuff you're excited about. Obviously, robotics will continue to be a trend. New implant design, surface technology, and augmented reality. I think that's something that's going to be really exciting in the future, specifically in the orthopedic and spine space. Can I just ask you, what technologies do you think will become more prominent as a result of the COVID-19 pandemic?
I think COVID-19 has really revolutionized telemedicine. If we look at virtual telemed going forward, there are so many barriers to that in the past, both culturally. Patients were not all that into it. They were concerned about data sharing and the platforms there. There was obviously cost and payment. Who would pay for it? The insurers, that was a big hurdle. And regulations in general. So there were some of the big barriers, but CMS really came in, and with this crisis has changed this around entirely. And I think looking at the future, while there may be a little restriction of it after the crisis, I believe it's front and center. I think patients' adaptation has been huge. We did telemedicine over 5 years ago. We put a system in there. It cost over $10,000 to reach out to the remote areas in our Nevada. And now you can do it on an iPhone or an iPad with truly no added cost. I think what's changed in that is, you know, the first week we started this in March, we said, we're going to do some telemedicine. This is great. We called patients, and patients were like, you know, is this a crank call? Please don't call me back. And within a week, they saw it on TV. They saw it in their primary care office that this was an accepted form of care. And then this was safety for the at-risk populations and for the rural populations, and it really was protection for our staff. So I think telemedicine is going to be huge. We've been working with TelePT for years. We partnered with, indeed, an Irish group, Salasso, over 4 years ago. And it's basically customizable remote physical therapy. We've been using it in our practice to good avail over the last 4 years. But the big issue was trying to get the insurance companies to adopt it and to actually pay for it. So this will change things around to see that this is an opportunity to have patients use telemedicine, whether it's TelePT, teleneurology has been well accepted, and telepsychology, because they're needs, they're specialties that haven't really been accessible to patients before. So I think that's going to change it. Obviously, teledermatology is a huge one as well. So I think if we look at COVID, what it's done, it's really fast-forwarded it. Something that would be harder for a hospital to institute a large group of practitioners really occurred overnight. So what would traditionally take years to change the mindset of the providers and the community and the patients occurred within a 1 month period, and now it's standard accepted practice. Taking that further, if you look at Teladoc, you know, their shares have gone. They're a $13 billion cap company. Their shares have doubled in this year alone, and patients are just using that platform. And that's probably the single biggest change. And I think patients themselves are just more consumer aware of what their opportunities are with their healthcare plans. And this will allow us to use the data with HIPAA-compliant data and safety measures and cybersecurity, et cetera, going forward.
I know, the advancements of telehealth and telemedicine has been, welcomed with open arms by orthopedic physicians over the past couple of months, and hopefully continues to grow in that space. But following on from that, I'd like to kind of get your insight on where you see, Jim, the biggest opportunities for spine surgeons in the current landscape.
I think like everything, it's regional specific for sure. It's very hard to have strong generalizations. And if we just take, the standard group, what do we have to do? We have to prepare for the future now. So I think building a musculoskeletal differentiated practice with the whole spectrum of patient care is important. I think the isolated silos of practice, whether it's surgery or pain management or P&R, working individually, I think, except if you're in remote areas, I think that's going to change. There's a rapid transformation occurring, and that may be not in months, but certainly over the next 3 to 5 years, I believe will be an adequate timeline. So I think preparing for that and differentiating your practice is important. I think focusing on partnerships or investment in an ASC platform, it's just a natural transition to see that. Currently, we can maybe it's 10-15% of spine cases are being done in an ASC platform. This is far too low. And Bain Capital came up and they thought this will change to 30 to 40% over the next few years. And I believe that that's going to be the case. If we look at preparing for value-based care, the lowest cost of service is going to be the facility that's going to be of choice. So if you're involved in a model where it's clinically integrated network, you're going to want to bring that patient to the appropriate site. For instance, while we're spine surgeons, carpal tunnel syndrome, carpal tunnel release is very common surgery that should never be done in a hospital. The cost of care of providing that time in a hospital is just too expensive for that lower acuity case, and therefore that lower reimbursement as well. So the reality is you have to get the right patient, the right procedure in the right facility. So basic surgeries, laminectomies, laminotomies, minimally invasive approaches, and the game has changed a lot. Minimally invasive spine fusions can be done easily in an ASC, and that's, as the technology evolves, the facility and the site of care will have to evolve. The same with anterior cervicals. We've been doing ASC in Reno, Surgical Center Reno, for the last 15 years, and our evolution has just matched the change in technology. So I think you put that together, and you just really have to look at your practice differentiation. We focused over 15 years ago on a platform of minimally invasive, and then just really focus that even further and double down in the last 10 years. And each 5 years, there's remarkable changes in technology, and we've adopted those, and we've really tried to differentiate that to work with outpatient surgery more, and whether that's in a hospital setting and they go home the same day or indeed less than 24 hours, that's a huge benefit to the healthcare system. And indeed, the patients want it. Patients are very aware of the advantages that gives it with lower cost of care, easier recovery, and less destruction, less long-term instability. As we're going forward, there's no question about it that access is important for your practice. Getting the patients in sooner. We developed Spine Nevada Direct, so patients could go and be seen in an earlier fashion with minimum symptoms, maybe acute back strain or musculoskeletal. We have a swift orthopedic urgent care as well that take care of that. And those patients that have 3 days of back sprain and they want to go to see a specialist, they're entitled to do that. But it's not a good utilization of resources if they wait 3 weeks then to see a neurosurgeon in a community. They should be seen acutely. And in doing so, with that access to care, it's lower cost, number one. It's you avoid the narcotic chain of events. You avoid pain behavior. You get the patient straight into physical therapy, very similarly to how an athlete would be treated. A high-level athlete is certainly not going to wait 3 weeks to see a neurosurgeon. They'll be seen immediately, get appropriate imaging, start physical therapy as a first side of care. And that's kind of the model that has to change, I believe. I believe the last thing is really just how we approach partnerships and alliances and how we really align ourselves going forward in a value-based care environment.
Fantastic. Thank you so much, Jim. On that note, touching on value-based care and strategic partnerships, with the goal, as the industry continues its push towards, achieving this value-based care and providing high-quality care, how important, how big of a role will consolidation play in the industry?
Consolidation. Once there's opportunity, there'll be consolidation. Whether it's the ASC environment, where 28% of surgical centers are controlled by large corporations. And then that gives opportunity because the other 72% are relatively independent. So when there's opportunity, consolidation will occur. And this results in better platforms for delivery of care. We're currently involved in partnering with a large national musculoskeletal partner who really developing a network of musculoskeletal centers across the country. And the idea is really focusing on population health, clinical integrated networks, and really at-risk models. So this is really aligning the physician groups who deliver the care with the hospitals and the healthcare centers and the healthcare plans indeed. And to do that, though, that's very difficult for a private practice to have that infrastructure involved. So it's sort of, where the next level is, but we don't have the individual infrastructure to do that. So that's where consolidation truly results in alignment, better outcomes, lower cost of care, and is really, transforming the whole healthcare paradox and bending the cost curve, as they say, to bring it down. And I think we're going to see more of that occur for value-based care. The West Coast, California has done it traditionally. The East Coast has really truly remained in a fee-for-service model. So the non-fee-for-service models are going to sprout out more, and I think the rest of the country is sort of a mix. But we're heading there in the next 3 to 5 years, I believe.
Fantastic. And Jim, finally, I'd love to get your 2 cents on what do you see as the leadership qualities most important for healthcare innovation?
Well, I think inspired physician leadership is really about creating influence and impact. So I use that kind of as my memory's not so good now, so I use little, mnemonics like that or little acronyms. So CI squared. So if you can create influence, and that's across a variety of spectrums, whether the influence is in your staff, number one, and your practice, amongst your partners, and the community. And then obviously taking that to another step forward with the hospital leadership and then insurance companies. You have to really take ownership there and create the influence. And now, how do you do that to have that impact? I think you have to have a disciplined approach as a leader to strategic planning. And then demonstrate really resiliency, and particularly times like now, that's important. Leadership has really come to fruition. You really have to lead through this crisis. You can't just manage or micromanage. There are people to do that. You should have that set in motion. You have to demonstrate transparency. And transparency has to come in a practice where you create a safety net. So that staff are comfortable, and then really so they can question and bring ideas to you without fear of personal repercussions. And that's important to have that open, transparent environment both ways. You need to have agility to be able to change with the times, and I think we've seen that very much so. It's kind of like an ARC effect. That's Richard Branson's, adapt and revise and change. And you have to do that. There's no question about it. Diplomacy is important as we negotiate contracts. So we try to put teams together, and the teams together are working with, some of our colleagues in the community, some of our competitors. So it's really seeing that the future together, that we are stronger together with better outcomes if we partner truly. And we got to put away some of maybe our distant paths or our disagreements. No question about it. There's a benefit to all in that. I think it's like everything, you have to have emotional intelligence. That's important. If you don't have it, you're at a loss. I think you can learn it. And you have to have humility. No question about it going forward. There are a lot of aspects to that, but I think as a leader, I think we all know the where we need to do something, how we need to do it, but the big question is why we need to do it. And I think if you can get that across the line and focus on that with your staff as to why you do something. So, for instance, if you tell somebody, look, we need to make a change here, we have to have cost reductions, we have to furlough people and all that. And as a leader, these are just basic economic principles, but you can't just assume that because then you're miscalculating. You're miscalculating their interpretation of it. So it's very important to get the why. And if you can get the why with your staff, with your colleagues, with your competitors, or indeed with the hospital, I think you're on a winner. And that's part of the leadership, to explain why you're doing something. We're going to do this, implement it because. And you have to explain because we're going to save, because we're going to give better patient care. And I think that's all, something you have to work on. And, there's a whole lot of opportunity to innovate your practice by developing culture and focus on that for sure.
Fantastic. Jim, thank you so much. For myself personally, it's been a real pleasure to have you on today, and I know from everyone here at the Becker's team, really great, and appreciate your time and your insights today. And to our attendees who joined us, thank you for making the time to be a part of our spine, orthopedic, and pain management driven ASC and the Future of Spine virtual event.